Hello, welcome to Tales from the ER, episode 63. Now, this story is an unusual one of a young man who came into the emergency department severely short of breath. And as we got a little bit more of his story and tried to sort out why he was so short of breath, he admitted to huffing chemicals to get high. And then he threw in by saying, oh, by the way, I'm transitioning from a male to a female. And so he was actually taking, estrogen-based hormones. And he had mentioned that he was having a lot of pain in the calf of one leg and was having a lot of shortness of breath come from that. His heart rate was very high, so maybe some of you who are in the field are already thinking acute pulmonary embolism, which is a blood clot in the artery of the lung. And so that's what we were thinking about as well. So we decided to go ahead and work him up for that, which means you get a CAT scan of the chest with contrast. And as we were preparing all of that, he started to look at us and his eyes rolled back in his head and he fell backwards and became unresponsive. So we rushed toward him. We had to begin CPR because he had no pulse at that point. And the presumptive diagnosis at that time was pulmonary embolus, given his history of a clot that may have traveled from his calf all the way to his heart and then lung. And so we did CPR, we intubated him, we tried to even give him medication to break up that clot, thrombolytics or fibrinolytics. And unfortunately, this young man died tragically right there in front of us, even though we were pretty sure we knew what was going on. So I called the coroner a couple months later, and sure enough, on autopsy, there was, in fact, a saddle pulmonary embolus. Pretty tragic story. Brings up a lot of issues of mental health in this country and the need to get people help who have drug abuse or other issues. Well, until next time, Tales from the ER.